And so we're definitely looking forward to this portion of the agenda. We will be addressing each of the speakers' remarks in the order that is listed on the website. Again, each speaker will have 5 minutes. I will provide a timing notification if required to allow people to wrap up in a way that's timely and allow for everyone else to provide their remarks. Before we begin our plenary mini talks, we want to welcome each other as respected colleagues. Our goals here are to think creatively together, and we want to welcome diverse thoughts and perspectives. We recognize that we may not always agree with each other or see the world from each other's perspectives, but all of the voices here represent independent expertise and valued thinking. As part of our workshop community, we will all engage with each other in ways that communicate the value placed on everyone's contributions and respect for each other. So this is something that we want to emphasize even as we give space for so many different speakers today, as well as for the participation within the breakout sessions. So this is a message that we want to reiterate, and we will. So I'd like to begin now with our mini talks. And first, I'd like to introduce Dr. Rashid Bashir, who completed his PhD from Purdue University in October of 1992. In October 2007, he joined the University of Illinois at Urbana-Champaign as the Abel Bliss Professor of Engineering and Professor of Electrical and Computer Engineering and Bioengineering. In November 2018, he was appointed as the 15th Dean of the College of Engineering. And so we welcome you now. We look forward to your remarks. Thank you for being with us, Dr. Bashir.
Thank you very much. Can you hear me?
Yes, we can.
And you can see the slides also?
Yes, we see your slides as well.
All right, very good. Well, thank you so much to NSF for organizing this terrific workshop. All the organizers, I know how much work it takes. I'll try to be brief. This is rapid fire, 5 minutes. I'll try to, I actually went and did the homework and listened to all the plenary talks, and I'll also try to present a summary of key points from those and how it might connect to what my talk was about. So my work is in point of care sensors for detection of disease biomarkers. And of course, the goal here is to see how we can use these types of sensors for predicting pandemics. I have to say there's, of course, a large group of colleagues across the country and across the world that works on these point of care sensors. And I do think that technology is at a point where we just need to be challenged. And I think this year, clearly, we all have been challenged to actually deliver and to have an impact in a real rapid fashion. So that's what you have seen all across, I think, in many disciplines, in many areas. This is just a one slide summary of kind of what I talked about in my talk, but also some recent work. So from the time the sequence for SARS-CoV-2 became public on like January 10th, and that is an important point because we need to have the sequence available, of course, of the pathogen that you're trying to detect if it's to be detection of a known pathogen. So from the time that was available, we were able to develop primers for what's called this RT reverse transcriptase LAMP, which is an isothermal amplification process. We developed these point of care devices in collaboration with two of my colleagues here at UFI, Professor Bill King, who is an expert in additive manufacturing, kind of shown here in the middle, these cartridges that can be very rapidly produced, and also being able to then use portable devices, smartphone-based sort of apparatus, but it doesn't have to be a smartphone. It can just be the optics of the smartphone, the camera, along with the associated electronics to make cheap handheld devices. So we were able to actually demonstrate this from NP swabs, nasopharyngeal swabs. I'm sure all of us have gone through those tests. And then also from saliva, which we believe is a really good alternative to NP swabs. Of course, the current clinical state of the art has started to already shift to nasal swabs also. So we believe saliva and nasal swab, where nasal swab being just the anterior swabbing of the nostril, is also can be a really good indication of the presence of virus. So we were able to do that and show that we can do this in 15 to 20 minute time frame and get good sensitivity and specificity from clinical samples working with OSF Healthcare in Peoria here in Central Illinois, and also Carle Foundation Hospital. Actually, some of this work was funded by an NSF Rapid grant that we were able to get early in the summer also. So this was detection of SARS-CoV-2, but this approach can be applied to all sorts of viruses. And in the past, we have demonstrated HIV, Zika, dengue, chikungunya, and now we're also working on multiplexed, of course, for this next season for SARS-CoV-2 and flu. One thing I want to mention really quickly in relation to the whole effort around pandemic, and I'm sure all of you have heard about our campus's effort for scaled testing. So I really believe that a lot of the challenges that you're seeing around the country and around the world, it's really a systems engineering challenge, and it's really leadership, and it's really pulling the right people together. We were able to demonstrate that on our campus. Of course, thanks to a very large team of people. Many of them are in the audience here, but charged by our Chancellor and Provost, and Marty Burke, who's Associate Dean for the College of Medicine here, led a big team. So algorithms for targeting, developing the saliva test, and being able to develop an app for, and pulling this whole thing together to really do a systems approach to protect the community. We were able to do that, and we have kept positivity rates less than 0.5% since September, except when students first came in early fall. We had higher positivity rates, but we were able to mitigate that and put processes in place. And now this approach, by the way, the COVID-19 Shield on campus has now been scaled across the state of Illinois with something called Shield Illinois. And also we are disseminating mobile trailers across the country through an entity called Shield T3. So you'll find all the details in my talk. So one thing I want to just very quickly, for all the plenary talks, I really enjoyed, and I think it was fantastic to bring this sets of people together. I think there's three kind of sets of plenary talks, at least for this one, from my perspective. Microbiome, it's really important as potentially a early indicator and biomarker. There was a really great talk on temperature and population density and climate models by Professor Ryan. I talked about point of care sensors. So I said there's, that's kind of the spectrum of the plenary talks at least. There's a lot of great work on modeling, detection of rare events versus extreme events. I really found that really interesting. The quick change detection, the idea of sub-epidemics and sub-outbreaks within an outbreak, and how maybe we should look for early indicators of these sub-epidemics. And then, of course, the components of an epidemic model, such as the dynamic social network. And then on the right, these three, I put them in sort of more the category of course, connecting now to the community, more so with thinking about cultural learning and social learning can increase the rate of adaptation, talked by Professor Jones. The whole, of course, really important idea of nosocomial amplification, which is really the jump of the disease from community to the healthcare system and the implications of that. And of course, also this idea of the fact that you could look at epidemics in animal first, obviously as an early indicator for spread in humans. So I think the talks were really fantastic. There's lots of connectivity. And the last thing I'll show is this slide. I believe what we are all working towards, and this workshop and all the workshop, is a systems approach, right? So how do we determine, how do we identify these pre-indicators, I would call it. You can give it different names, but how do we identify and monitor these pre-indicators, environmental, epidemiological, population, illness, food, water supply, so perhaps social media, social data. Of course, this piece right here, which I think is talked less in today's workshop, but it's really important for us to collect and sequence the genome of pathogens. In an ideal world, you'll do it for all pathogens, but that's a humongous task. So identifying the highest risk one and having the sequence available of current, and of course, the future one as soon as they come out, is critical to anything that we want to diagnose, right? So I put that in bold because that's really important. Of course, then, in terms of testing, from where I come from my space, I mean, what, where, and how often to measure. So we need that input from the modelers, from the social scientists, from others, what to measure, when to measure, how often to measure, in addition to what's measured in the clinical realm of course, taking patient samples in the hospital, right? So water, food, environmental samples, human samples, at airports, train stations, seaports. We're talking about pandemic, which is defined as spreading across countries and spreading across continents. So we need, should we have regular checkpoints of these specific things at specific sites? And of course, the mitigation strategies, there's a lot of, the modeling has driven the mitigation strategies of when to lock down, how to lock down, the quarantine, the public health measure, and all of this should be driven by modeling, data, analytics, machine learning, and all. Of course, as you have the sequence available, you can launch the drug development, the diagnostic scale up, great success in drug development around the country, of course, around the world this year. I think diagnostic scale up, we did not do a good job across the country and across the world. It was totally doable, but it wasn't done. And then, of course, the whole idea now of deployment and distribution of not only diagnostics, but also vaccine. So with that, I'll stop. I look forward to discussion. I really enjoyed the sets of talk, and thank you to NSF.
Thank you, Dr. Bashir. Okay, and next I'd like to introduce Dr. Jana Bromberg, who received her degrees from SUNY Stony Brook and Columbia University. Her work has been recognized by private and federal agencies, including NASA and NIH. She received an NSF Career Award and is also a fellow of the Munich Institute for Advanced Study. Her findings consistently indicate that our world functions via dependencies and interactions at all scales. Dr. Bromberg.
Hi, thank you for having me here. This is super exciting. I actually took the opportunity not to put slides together for this particular thing. I think that it will go faster if I just talk about it. But after Dr. Bashir's introduction, it's really awesome. I don't have to summarize anything anymore. It's all good. So specifically, my lab studies molecular function. As you guys heard just now, we study molecular function and the way that the interaction in molecular functions actually defines what we're seeing. We're particularly interested in the microbiome and the host microbiome interactions. So interactions within the microbiome and the host microbiome interactions. And that's why we look at a lot of microbiome samples that people submit to our tools to analyze. And I think that's a very good connection point for tracing viral evolution if we were to go that route. So that doesn't happen currently, but we're actually considering this. Thank you to the organizers. That's where we started considering this. So the way that I see the talks and I guess the world of virus control now is in four categories. One is biology, so detecting the new virus strains, or even bacterial strains, detecting the direction and the drivers of viral evolution. So that's the biology part. Then I see the medical part, which is the treatment development, rolling out testing, medical supplies, and so on and so forth, as well as control. And then there's the controlling the spread, which is basically forecasting events, let's say infection, or cost-benefit analysis in evaluating preventative action, and vaccine distributions, and so on and so forth. And of course, people, because apparently they matter in pandemics. So explaining the science of spread to people, I think, is a really interesting and important part of controlling the spread. Anyway, I have now a million questions that I want to talk to people about. We are interested in mapping the environment of virus spread. So that's super interesting. We're interested in maybe introducing new testing sites so we can collect sample data without knowing what we are collecting, and then analyze it using all of these techniques that we may have, maybe in the subways, maybe in the hospitals. Then we are also interested in figuring out whether picking up a specific viral load is an extreme event. I don't know, it may be or not. And I would love to know what we are missing in explaining the threat to people. So ideally, I want to know how we can connect the research space for identifying viral threats to the reality on the ground. So how do we talk to each other and to everyone else? And I think that's the main point of this particular workshop, because I don't actually come in contact with most of the science that was described here, and I found it fascinating, and I think this will be very fruitful.
Fantastic. Thank you so much, Dr. Bromberg, for your remarks. And we look forward to having you engaged in the rest of the conversation as well. Okay. So we're going to move to our next rapid fire plenary speaker, who is Dr. Gerardo Chawo, who is the professor of mathematical epidemiology in the Department of population health sciences in the School of Public Health. He also holds an external affiliation as a senior research fellow at the Division of International Epidemiology and Population Studies at the Fogarty International Center, National Institutes of Health. Before joining Georgia State, Dr. Chowell was an associate professor in the School of Human Evolution and Social Change at Arizona State University. We look forward to your remarks. Thank you for joining us today.
Thank you very much. Yeah, thank you. I would like to thank the organizers for inviting me. I'm a mathematical epidemiologist, so I use and develop mathematical models to study the spread of infectious diseases and the role of interventions. We have been very busy last year and less this year with the COVID-19 pandemic. And so for this mini talk, I really thought about what would I do if I had a limited amount of funding to develop new collaborations, right? What type of collaborations, what type of projects can we put in place to improve our ability to detect and predict the course of epidemics and pandemics, right? So obviously in 5 minutes is very, very difficult to put everything together, but I'll throw some ideas, starting with some of the keywords that the director of NSF, Dr. Panchanathan, said this morning. Building capacity, right? Synergies, real-time tracking, monitoring, and integration. I believe there are lots of data out there, lots of efforts at putting together data sets on sociodemographic and behavioral patterns, mobility, models, technology, but all of these efforts are spread out and need to be integrated. So obviously that would be a very important effort at bringing together all of these different pieces of data and models and technologies. And for that, we need guidelines. We need ways to put them together in a coherent, consistent way. We need consistent language to be able for all of the interdisciplinary scientists to understand them and access them. So I think those efforts are really, really needed. And I think that could have improved our ability to predict the course of the pandemic in this country and elsewhere as well. In terms of data, it's not only about the amount of data, but also the quality and quantity of data. Sociodemographic data, mobility data, there are important efforts that appeared throughout the course of the pandemic, but need to be integrated. At the same time, we need an effort to train the emerging scientists, researchers that are being trained in different universities so that they can talk to each other a consistent language, collaborate. We need ways to characterize transmission settings, right, across a range of infectious diseases. I'm thinking about the talks by Dr. Ryan and Dr. Lofgren, characterizing healthcare settings, characterizing human environmental factors, the presence of mosquitoes and other vectors that are relevant for the spread of infectious diseases, but because we should be thinking beyond COVID-19, obviously. And quality of the data, it's amazing that, for this COVID-19 pandemic, we didn't have an official repository with surveillance data. It was an effort really of the New York Times and other efforts like the COVID-19 project. Until, more recently, other agencies, federal agencies have put together some efforts, but it's still the amount of noise and quality in the data makes the utility of the data set quite limited. And it's very, very risky if we are basing our predictions on data that it's not of good quality, right? So can we actually detect signals, relevant signals from the noisy data? Obviously, we need many, many more variables included in these data sets in order to be able to integrate them into, artificial intelligence tools I know the NSF has been pushing forward very heavily on the artificial intelligence front. And in fact, I'm part of a larger, much larger team that submitted a grant on the AI Institute proposals that I think could play a very important role in bringing together different models and data sets to improve our ability to predict. I'm very interested also on ensemble modeling ideas, right? You saw my talk about the idea of characterizing transmission in terms of sub-epidemics. So how can we ensemble models at different levels of spatial scales organization to improve our ability to predict the course of the pandemic, but also predict where are the settings that are most likely to see the next pandemic emerge. Let's see, in terms of technology, Dr. Bashir mentioned very clearly the need to advance the technology front as well. You know, we didn't have rapid diagnostic tests prior to 2020, right? We need to speed up the development of rapid tests and the development and validation of rapid tests in order to be able to detect the emergence of new pathogens and possibly stomp out those outbreaks. Because what if we had all of these technology and resources available during the early phase of the pandemic? It is not, you know, far-fetched, I think, to think that we could have mitigated substantially the pandemic early on.
Dr. Sharma, I'll ask you just to take a moment to wrap up.
Okay, all right. I think I covered pretty much all of the items that I had in my list. I think the main, just to summarize, I think the integration of efforts, developing systems to integrate all of these resources and efforts that are already ongoing, development of repositories, and obviously the science, developing new collaborations to improve the basic science, you know, across the many different disciplines, and improving the way in which we can connect with each other. I think that that's also very relevant. And yeah, thank you very much.
Yes, thank you. We appreciate your remarks, and again, look forward to having you in the remainder of the conversation as well. I'd like to introduce our next speaker. Dr. Demirci is currently a tenured professor at Stanford University School of Medicine and a principal investigator of the Demirci Bioacoustic MEMS in Medicine Lab at the Canary Center at Stanford for Cancer Early Detection. He received his BS degree in electrical engineering in 1999 as a James B. Angle Scholar, summa cum laude, from the University of Michigan, Ann Arbor. He then received his MS degree in 2001 in electrical engineering and MS degree in management science and engineering in 2005 and PhD in electrical engineering in 2005, all from Stanford University. We are grateful to have you here as well, and we look forward to your remarks. Okay, so we may not have Professor Demirci with us at the moment, so we will move to the next. Yep, we're going to move to the next speaker, and then we will revisit Professor Demirci later if he is able to provide his remarks. Okay. All right, so then next I'd like to invite Dr. James Holland Jones, who is a biological anthropologist with research interests in human ecology, demography, and life history theory, and the ecology and evolutionary biology of infectious disease. Sampling of current projects include human dimensions of primate retroviral transmission, the impact of mobility and social contacts on the spillover and transmission of avian influenza, and the demography of residential mobility among Hadza hunter-gatherers. Professor Jones, we are grateful to have you with us, and we invite you for your remarks.
Thanks, Taylor. I'll just give a quick overview of what I talked about, that I think that cultural evolution can actually help us make sense of both heterogeneity and social structure and the control of pandemics. It seems that I am the advocate for theory here. I'm also the advocate for the social sciences, the social and behavioral sciences, which is kind of funny for both of those things, because on the one hand, I like data. I like to do data analysis. But I feel like someone needs to speak up for the importance of theory in general. And I also feel, I self-identify as much as a biological scientist as I do a social scientist, but I also feel like we need to bring the social and behavioral sciences fully into these partnerships. I suggest that every transmission event has a social cause. It's embedded in the very formalism of the SIR family of models and any other sort of transmission dynamics models. Uncertainty activates social heuristics. And I think that this is really important because we're finding it very difficult to control epidemics because of the behavior of collectives of individuals. And, we can come up with the cleverest optimization algorithm for getting out vaccines, but it doesn't help us if people are actively denying the existence of a pandemic, right? And this is a really interesting phenomenon that's piqued my interest and the interest of a number of other people's, and I think has enormous implications for our ability to control emerging threats such as pandemics. We can see that populations can bifurcate when there's strong outgroup aversion and strong homophily, where people interact primarily with people like themselves. This can lead to really interesting and cyclical and alternating dynamics in structured populations. When we have skepticism for something like mask wearing vaccine adoption in a population, we have some adoption curves where you have a group who are essentially skeptics, who are going to do the opposite of what most people do. We get ourselves in a situation where you can actually have, despite being in a propitious situation for widespread adoption, you can actually end up with essentially zero adoption if you play the dynamics wrong. And so we have to be aware of these sort of pitfalls. We also have to be aware of the fact that when we engage in socially mediated interventions, where we want things to spread socially, we have to understand the social structure of the population, that if we want to reach this entire meta population here, the people in the core are not going to be able to receive information, and they're probably going to resist information from people in this core. And we have to identify these bridges, just like we do when we're doing contact tracing for sexually transmitted infections. And there are ways that we can do this using sort of standard social survey questions. Heterogeneity isn't going to save us. You still see it. I mean, I've seen it on Twitter in the last week where people are saying, well, actually, the herd immunity threshold is much lower than we thought it was going to be. It's more like 20%, and it has to do with heterogeneity. There isn't that much heterogeneity in social contexts for respiratory pathogens. This is something that Marcel Slaudet and I showed, a decade ago. And I think we need more sort of stuff like this, understanding contact patterns, understanding the networks and the larger structures that put together the risk, and collective behavior leads to cycling, right? We're seeing people saying the only reason we can see the kind of decline that we're seeing is because of widespread immunity. And that's simply not true. The behavior of the host, particularly fear-mediated behavior, when there's a large social component to transmission, as there always is, right, is going to lead to cycling under certain conditions. So those are my big points. I think we need better theory of infectious disease and the human behavior elements at all levels of human social organization, from the individual psychology to the collective behavior and what that's going to do. I think I was really excited. Sadie Ryan's talk, she's doing this famously atheoretical thing, right, which is making maps, and she builds this incredible mechanistic theory into that that map making exercise, right? That we have a mechanistic understanding of the thermal physiology of arthropods. It's built into that. This is the sort of thing we need more broadly. I love Gerardo's talk where he's talking about heterogeneity in these epidemic curves and how what we're seeing might be actually mixtures of smaller epidemics, right? I think we really need to integrate more theory, because when we're at the beginning of a pandemic in particular, right, we are in an information poor environment, right? And as I've suggested in my talk, when we're in highly uncertain information poor environments, we kick in the heuristics, and those heuristics may not actually lead us to the best place. And so this is why I think we need to develop better theory and better tools for dealing with information poor situations, because otherwise we're going to be caught with our pants down again when the next pandemic emerges. So I'll stop there. Thanks for inviting me. This is a fun opportunity.
Thank you so much for responding to the invitation. We definitely appreciate having you. We're grateful for your remarks as well. Okay, so we're going to move to our next speaker. Okay, so Dr. Eric Lofgren is an infectious disease epidemiologist whose research focuses on the use of mathematical and computational models of disease transmission, particularly the transmission of antimicrobial resistant infections within and outside healthcare settings, as well as emerging infectious diseases. His work often focuses on producing policy relevant results, working hand in hand with clinicians and policymakers to produce reproducible quantitative guidance for designing and evaluating public health interventions. We're grateful to have you today. We look forward to your remarks. Thank you.
Thank you very much. So really what I'm interested in talking about sort of for my little 5-minute chunk of this is some of the intersections I saw between my own work, which is looking at how when an infectious disease reaches the healthcare system, it often ends up sort of amplifying and disseminating an infection, and a lot of the other sort of plenary talks we've seen in no particular order, which turns out to be alphabetical. Dr. Bashir, I thought there was a really interesting sort of parallel in non sort of pandemic settings between some of your work in sepsis and a lot of work I do in antimicrobial stewardship, and how those things are often very, very much in tension and sort of falling on the shoulders of the same people, where the anti-sepsis guidelines say just start giving antibiotics to people, and the antibiotic stewardship guidelines say wait until you have a diagnosis and a susceptibility test, and sort of asking people to figure out both of those things at the same time. And then also with sort of the rapid diagnostics, I thought there was a really interesting sort of way to resolve some of these problems in hospitals, because one of the things we see is that the attack rate for a lot of hospital outbreaks are driven by these delays between when a case arrives and when we recognize that case as a case and put in contact precautions and things like that. And so identifying those pain points, and one of the ones that sort of got a technological bent to it is that question of how fast do you get a test? And how fast does that test produce an answer? And then sort of in parallel, one of the questions I've been sort of confronting while responding to the pandemic at our university is how fast do you go from a test to actually being in an electronic medical record system? And that often turns out to be sometimes slower than the test itself. Dr. Choel, I had to sort of chuckle when I saw your slides. The exponential forecast slide that you put out very early, I made that forecast. The good news is we didn't like it at the time either. And so one of the things I really took from your talk is this idea of imagining hospitals as sort of a third layer of mixing. You know, you talk about households and then communities, and then you can sort of envision hospitals as a way to aggregate potentially non-overlapping communities into producing these sort of mini outbreaks that end up having an epidemic curve that looks like a single outbreak. And some of our own work with healthcare associated infections suggests that what looks like an endemic process is actually sort of a series of stochastically self-limited microepidemics that just keep getting reseeded into the same place. One of the things I thought's been really interesting about COVID-19 and working with this is, while the focus of your talk was sort of on producing the the national level or the state level epidemic curve based on these smaller sub-epidemics, I think the polite way to put this is the decentralized nature of the response to this pandemic has caused, I think, a lot of people to really start focus on those particular forecasts for sort of each microepidemic, as you see individual hospitals and workplaces and things like that trying to use epidemic forecasting to understand demand for PPE. Dr. Jones, I thought there were some really interesting parallels with this idea of sort of what makes the structure of a network, how do those behaviors arise? And for a pandemic, as compared to a lot of healthcare associated infections, there's all sorts of behaviors that we used to be able to ignore that we can't. When you're modeling MRSA or C. difficile, you don't worry about staff break rooms. And in COVID-19, you absolutely do. And one of the things I think is interesting is you focused on sort of transitions in behavioral regimes, but there's also heterogeneity in the disease itself. So while nosocomial COVID-19 is a respiratory pathogen when we think about it most of the time, as your case gets more serious, your transmission shifts sort of from what you do to the things done to you as your exposure profile becomes aerosol generating procedures and things like that. So I thought that's sort of an interesting switch. Martina Morris, I have a deep fondness for ERGMs, and all my students want to use them, having taken your workshop. And I think there's some obvious parallels between some of the metapopulation work we've been doing and what you mentioned about sort of rewiring networks in hospitals to avoid isolating people, which I think is one of the great sort of challenges, and one of the reasons I'm interested in network epidemiology in hospitals is, unlike a lot of networks where the answer is, can you just disconnect people? When people arrive in hospitals, they inherently need care. So sometimes the more infectious you are, the more contacts you have as you start getting more intensive care in those questions. And also, I think you did a really valuable job highlighting the importance of data streams being collected ahead of time. And I think one of the things that we'll need to do after COVID-19 is sit down and sort of think about what data streams did we need that we didn't end up having. So one that comes to mind sort of immediately is universities. There's sort of a paucity of data in how universities interact with their surrounding communities. Similarly, for my own work, rural hospitals and sort of smaller community hospitals, which have borne a lot of the brunt of COVID-19, we have very little data on them. We have lots of parameters from tertiary care academic medical centers, but not much from, for example, Pullman Regional with our 2 ICU beds. Dr. Ryan, I think there was a really interesting notion of how do we actually see risk? We make these cool maps of, habitat suitability and species distribution. And then the question is, okay, but what's the underlying sort of population in those places? And I think that's a really interesting challenge, especially when you hop between scales and what scales sort of we have data at and what scales decisions are made at. We've been working with some GIS folks on sort of thinking about what I've jokingly called behavior suitability, or sort of susceptible distribution maps for Pullman, because we can see very distinct clusters of things like Greek Row in our town and things like that, where you can see that on maps. And we've sort of run into the opposite problem you mentioned, which is sort of the paucity of data and not being on the right scale, is that we have data that's absolutely on the right scale and we have very rich data about it. And the problem is, in a town of 30,000 people, that starts to get identifiable pretty quickly. And so we've started to sort of have to pull back on the granularity of our data, because you can start pointing to individual houses and going, oh, I know them, they had COVID. And then finally, Dr. Sapsis, in a non-pandemic context, change detection is of intense interest to hospital epidemiology. I can't convey how much time is spent by very smart clinicians staring at extremely noisy data, telling just so stories about why a line is going up or down at any given time. And this ends up having very large consequences that, you're potentially looking at essentially random noise, but everything from infection control decisions to Medicare reimbursement rates is being determined by sort of moralizing that noise. And so I think there's very interesting applications for change detection in a system where you're dealing constantly with just rare events and extremely stochastic systems. And so I'm very excited for the rest of this workshop and to be able to engage with you all. And thank you very much for your time.
Thank you as well. I want to encourage everyone again, if you do have any questions or any comments, anything that you'd like us to follow up on in our discussions, please feel free to use the chat function. It's great to see some of the interconnectivity of the conversations that are taking place so far. So thanks, everyone. And thank you, Dr. Lofgren, as well, for your remarks. Okay, and so our next presenter is Dr. Martina Morris, a sociologist with interest in the analysis of social structure and population dynamics. Her research is interdisciplinary, intersecting with demography, economics, epidemiology, and public health, as well as statistics. Dr. Morris, we welcome you. We look forward to your presentation. Looks like you're queued up and ready to go.
Yeah, I wasn't sure how many buttons I would have to push and how long it would take. I'm sorry to have interrupted what you had up on screen.
No, it's fine. Don't worry. It's perfectly fine. Thank you so much.
All right. I want to thank the organizers for inviting me to this talk, this workshop, and I'm excited to see what comes out of this from the different perspectives. And I thought what I would do with the 5 minutes that I have is maybe just briefly try to set the stage for how we can talk to each other over the course of the next 2 days, because I think the fact that we come from these very different backgrounds means that we could find ourselves often like ships passing in the night, trying to say things that the other doesn't understand, or arguing about things that we don't actually have to argue about. I have had a lot of experience with that as a sociologist coming into these circles, both people who come from ecology and evolutionary biology who have done, I would say, the lion's share of epidemic modeling that I'm familiar with, but then also computer science and electrical engineering, which work largely on these systems analyses. And so, so please take my comments right now in that spirit. So I'd like to at least identify, many people probably know this, so I'm sorry if this is old news, but I just want to make sure that we're all kind of on the same page in terms of understanding that if we're talking about mechanistic modeling for epidemics, which is really sort of modeling, simulating the epidemic itself in silico as it is, there are different frameworks out there, and the different frameworks, people tend to learn a framework and work within a framework. But the different frameworks, it's not as though one is better than the other. It's kind of like if you've got a nail, you probably want to use a hammer. If you've got a screw, you know, a hammer is probably not such a good tool. Maybe you want to use a screwdriver for that. So, so kind of the workhorse, I would say, of epidemic modeling has been the deterministic compartmental models. That's what we call them, at least. I'm not sure what they're called in systems engineering, but it's basically stocks and flows. And so these are often continuous time, continuous rate models, where you don't identify individuals per se. And as a good friend of mine in the epidemics modeling field said, the problem with these models for epidemic modeling, like for rabies, is that you always have, you know, an addofox running around who's infected with rabies, so you can never really get to eradication. So a lot of the work, especially in the field where I come from, which is modeling for HIV, both to understand the transmission dynamics and then to understand how you can actually intervene into that system and potentially end the epidemic, which is kind of where the modeling is now, has moved away from the focus on compartmental models to agent-based models. Agent-based models are, you're looking at agents, the individuals. So you're down at the kind of individual level. They're typically stochastic. They create networks, but I would say that agent-based models are not necessarily network models. And so I want to just say a little something about why network models are different. And I would say that the key thing is that a network model is a predictive model that has the network on the left-hand side. Not the behavior of a dyad necessarily, but the entire network. So agent-based models they predict individual behavior and sometimes the way in which individuals meet in the process of executing that behavior. A network model actually has the entire network on the left-hand side of the equation. So that's how you identify a network model. And what I want to, so an example of that is the kind of modeling that we've used that Eric made a comment about, the ergom sort of framework. And basically here, the network's on the left-hand side. And what's on the right-hand side is this vector of network statistics. And the network statistics make your network more or less probable, because this is a fully stochastic model, so that's the probability on the left-hand side, as a function of what the parameter weights are, basically. So some configurations, that's what network statistics are, just configurations in networks make your particular observed network more likely. So what I would like to just to say about the kind of work that we do is there's typically a distinction. This is another big distinction made in the epidemic modeling field between people who use statistical models and people who use mechanistic models, right? But I think there's a place where those two things actually become integrated, and that is when you use a statistical model to do your epidemic simulation. And that's basically the framework that we've designed. We've got a statistical model here. We use a temporal ergon, basically, which is a generative model for the dynamic social network. We start by estimating the parameters of that network from data. So there's an estimation step because this is a statistical model. The fully specified model, once you have the estimates, can be used then for simulating the epidemic. So you've got one model in the middle that is both a statistical model and to a certain extent an epidemic model. It's the transmission network part of the model. So based on that, then just a little bit on how do network analysts think about modeling networks? Well, the question of scale is sort of front and center. So what's the level at which you are trying to model a network? There are macro level models for networks, which are really kind of these global flows. Meso models, which are more the kind of thing that Eric Lofgren was talking about, where you're trying to represent patterns of flows in communities. And both of these often use what we call a bipartite reference or framing, which is two modes. There are persons, for example, and places, persons and settings. And then there are the micro level models, which typically use one mode. So then you're representing sort of all individuals and the ties between them.
Oh, no.
Settings, the structured settings. Okay, I'm just about done, which is perfect. So what I want to end with is just some thoughts on what I think if we're interested in this sort of representation, and I think it is useful for understanding the heterogeneities, some of the interesting dynamical patterns that we observe in all types of infectious disease transmission. I think focusing on these statistically integrated epidemic models is a useful approach because it links the data to the epidemic model, which means if you're interested in actually changing what's going on in the real world, you're starting with the real world. So I think what we need is more understanding of how to do bipartite network modeling in this area and some methods for estimating models like this from linked trace network data. I'd say from the data side, we need to be doing proactive data collection. So I'm going to echo what Eric Lofgren said there, active sampling and passive stream designs that are designed to feed into the modeling framework, not just sitting out there by themselves. And on the computing side, all of this is very computationally intensive. All of our work is as well, but we have made remarkable gains. Even in the last 6 months, we've had like 4 to 6-fold orders of magnitude improvements in our MCMC algorithmic efficiency by beginning to drill down and develop bespoke algorithms for particular patterns in the data that we're seeing. So that's where I will end, and thank you very much.
Thank you, Dr. Morris. We appreciate your remarks. And we're going to move now to our next speaker. So I'd like to invite Dr. Alex Olszewski, who is an assistant professor in the Department of Electrical and Computer Engineering at Boston University. Dr. Olszewski is a recipient of the NSF Career Award, the Young Investigator Award from the Air Force, 2 Best Paper Awards from SIAM and Informs, and 3 awards for teaching advising during his time at the University of Illinois, Urbana-Champaign. So Dr.
Thank you very much.
Yes, thank you.
Can you hear me and see my slides?
Yes.
Okay, great. So thanks very much for the invitation. I'm going to use my 5 minutes to sort of reflect on some connections to work done by others here and reflect on possible directions. And somewhat predictably, this overlaps a lot with some of the other talks we've had. So I see now actually what I'm going to say is going to overlap a lot with Eric Lofgren and Dr. Morris. So my background is in control and optimization. And over the last maybe year or so, I've been working on applying some of my expertise to COVID spread. So one of the most very natural things to me is to look at the sort of compartmentalized models that we've just heard a discussion of. So many works in this area take something like an SIR model and fit it to COVID, or a SARE model, or some modification of these, including delays with a little bit of stochasticity, et cetera, et cetera. But when you derive such models from, models of human interactions, you usually make an assumption, which is that infected and susceptible individuals interact at a certain rate, which is not quite all that natural. What's more natural is to have a model that's based on geography, because we all know that we interact with people that are geographically close to us, more so than people who are geographically farther from us. So you can take any one of those models, and I have on the slide a simple SIR model, and write down a network version of it, where instead of interacting between susceptible and infected, you add some kind of network coefficients that incorporate this geography. And there, as I say, it's very natural to do it, but the question is then, how do you estimate these network coefficients? How well do you know them? And can you use them to develop in your research? So I'm gonna quickly flash a slide from my longer presentation. I'm not gonna describe all of the assumptions that go into this. Point I want to make though is that there are quite a few things you can sometimes say, even without precise knowledge about network interactions. So one of the questions we were looking at is, how would you do a lockdown? Okay, that is heterogeneous. So this is a map of New York State. New York State has, I think, 62 counties, and we were looking at different lockdowns at different counties that send, I guess we wanted to achieve a 4% daily decline in the number of COVID infections. And we used data on interactions on April 1st from a service called SafeGraph. I'll say something about that in a second. But what we found is interesting. We found that there are patterns that seem to exist even when you change models. So here, for example, I show SIS model, SIR model, a different model of COVID-19, which tries to capture the different layers, like you have asymptomatic and symptomatic individuals, which transmit at different rates. And what we did is we computed an optimal lockdown. Optimal means you want to minimize the cost. The cost of shutting down a county is proportional to its employment or proportional to its population. So we tried to find an optimal lockdown to achieve a certain rate in terms of minimizing cost. And even across many different models, the structure is kind of the same. And you can even see this in these charts here. Red, it means a harder lockdown. Not only that, but there are some of the features here are counterintuitive. On April 1st, 2020, when we used this data, most of the epidemic was localized in New York City. I think roughly 75% of the cases in New York State were in New York City. And yet the optimal lockdown actually hits places outside of New York City harder, because it looks at this network structure and it tries to minimize sort of not just what's happening right now, but the flow of the epidemic to zero. But what is this based on? It's based on data from a service called SafeGraph, which gives data for, it sells data. It's a private company that sells data to other companies, but it gives its data for free to researchers. It's not entirely 100% clear what sort of sampling bias is present in this data. So SafeGraph pings cell phones, and then it tells researcher how many minutes you spent outside the home. A typical person spent outside the home, and how many of those minutes they went to this particular county, how many minutes they went to that particular county. So it oversamples people with cell phones, obviously, since that's the only people it samples. But it's also not clear what proportion of that time people are, for example, within their cars. So if you're alone in a car, even data that tracks cell phone movements, it will count you as outside the home, but you're not necessarily spreading a disease to other people. So the high level point I want to make here is that while there are a lot of things you can say qualitatively, patterns of, let's say, optimal lockdowns, and we also did some work on vaccine allocation and so forth, if you want to translate that into very concrete predictions, we need to be able to say, at least at the macro level, statistically, where people travel. And having data that we are very confident with, even in the United States in 2020 or 2021, is something that is not available right now and would be great to fix. I'll conclude by saying, even besides that, one thing we can do, presumably such data will become available in the future. But before it does, we can analyze some of the properties of these systems theoretically, right? So the questions that we want to ask is, how does the network structure influence the development of the epidemic? So there are some counterintuitive properties. So I'm going to mention one very briefly. In some of our simulations on lockdowns, we found that a partial and temporary lockdown, where you lock down some of your network for a time and then you stop, can actually make things worse rather than better. That will not happen in a non-network model. In a non-network model, you know, if you partially lock things down, things should be okay. But what happens in a network, or rather what can happen in a network model, keep in mind that what I'm describing is somewhat of a rare phenomenon, is that you do a partial shutdown, and that does help to send the number of infected individuals to zero, but it transfers the profile of who in the network is infected. And then starting from the new profile, actually, the final behavior of the epidemic is worse, even though fewer people initially were infected. So a shutdown, for example, can make things worse. And that's something that we can study theoretically by examining which models on which networks have this property. And we can study other questions, like, for example, when do we need coordination? When can just purely local policies do as well as global policies? By local policies, I mean we set lockdowns in every county and every location independently, sort of like much of the United States is doing now. There was a great presentation by Maria de Bernardo applying this to Italy. And we can ask about, for example, the information theoretic limits of epidemic prediction. So part of the reason why it is so hard to predict the ultimate flow of the epidemic from network data is that you can come up with different sets of coefficients on a network that look similar initially, but then diverge over time. So that even unless you have extremely, extremely accurate data at the initial stage, your predictions for the final state of the epidemic will actually be quite inaccurate. And that's not necessarily, it's an information theoretic limit. So it's there in the sense that noise is hugely amplified in this final prediction. So again, this is something that can be studied even now as we kind of wait for these, for data on human flows and how people travel to become available. And with that, I'm maybe going to conclude and thank you for your attention.
And thank you, Dr. Olszewski. We appreciate your remarks. We are now at 12:30 on our agenda, and so I'd like to invite everyone to our first break. So we have a half an hour. We will be returning at 1:00 p.m. to conclude the rest of our lightning round of plenary presentations. So enjoy your break for now, and I look forward to seeing everyone back in about 30 minutes. Yeah, and there's nothing wrong with being recorded as having great taste in literature, so, especially sci-fi and even Afrofuturism. So I appreciate it. So thank you, everyone, and welcome back. We are returning from our break, and we just want to take a quick moment just to address just a few things. So we want to say that we heard all of the comments in the chat. We know that some of you have not had access to some of the plenary talks that were recorded prior to the workshop, and we do want to make sure that that information is available to everyone. And we know that some of you did not have access to the breakout rooms as well. So we're working on mechanisms for all of this. So I want to take a moment just to turn the microphone back over to Dr. Pfefferman, just to provide just some quick remarks before we move back into our lightning round of plenary talks.
So thank you so much, Emmanuel. And yes, thank you, everybody. Our apologies for any technical glitches about this. We're definitely figuring out how to do flipped conferences in real time. And it is true that it seems some of you haven't had access, and we apologize. It should be that some of the links sent earlier in the first panel session do take you to the plenary talks if you haven't been able to see them yet. We'll post that in the chat again. Also, we apologize very much that the breakout sessions this afternoon, we do have limited space. We do want to hear from all of you, but we weren't able to arrange. So if you have not yet gotten an invitation link to the breakout session and you would like to be part of that, please email the email addresses in the chat, and we'll form a wait list. And whenever people can't make it or we have extra room, we will send you a link to join us. But even if you can't join us because of space, and again, we apologize, we're going to be soliciting feedback from all of you. We want to hear all of your thoughts and contributions to this. So we're going to be sending after the workshop a very open-ended, like, please tell us all your thoughts, conversational form. And that's not going to, we're not going to ignore those. That's going to be integral to our understanding going forwards. But hopefully also we can fit all the people who would like to participate today. So please, if you're interested in the breakout sessions today and haven't already been invited, please do send an email to the two email addresses in the chat. And again, we'll repost the link to the plenary talks. Thank you so much for your patience as we work out all of the kinks in the system, but hopefully this will still be a way that everybody can access and engage and contribute, because that our goal is to involve everybody. So thank you so much.
Yes, and thank you, Nina, as well. So welcome back, everyone. I hope you enjoyed your lunch, brunch, breakfast, whatever you happen to be enjoying, wherever you are in the world. And we're going to jump back into our plenary mini talks at this time. So I'd like to take this moment now to introduce our next speaker. Dr. Sadie Ryan joined the Emerging Pathogens Institute in the fall of 2014. Along with her work with EPI, Dr. Ryan also works in the College of Liberal Arts and Sciences Department of Geography. Ryan received her PhD from the University of California at Berkeley in 2006, and her research interests include disease ecology, tropical conservation, human-wildlife interface, and spatial modeling. We are grateful to have you with us, and we look forward to your remarks. I think others have already started to refer to your work, so in that regard, your reputation precedes you.
Thank you so much. I am going to share my little slides here, if that's okay, because I know everybody took the time we just had to go and watch my plenary talk. I'm gonna go through quickly, just summarizing a bit of what that was, since people have referred to my maps, and then I'm going to sort of summarize with some of my sort of ways of thinking about what I've seen from the other speakers. And I know it will be repetitive and overlapping with what previous people have said, but repetition is how we learn. And so hopefully that will sort of spur everyone back into action after lunch or brunch. And so the talk I gave was about shifting risks and thinking about global change and vector-borne disease suitability models. And obviously my stock in trade is coupling these mechanistic models to climate maps. And so creating a sort of map of risk as a function of climate or of other change. But so basically we took these mechanistic models, we took advantage of the fact that arthropods are delightfully attached to temperature in all of their life history traits, and the sort of vector and pathogen development as well. And so these are life history explicit models that we can then shove into an R0 expression for transmission as a function of temperature. And then I came along and sort of hooked these up to climate layers as a way of describing where does this happen on the landscapes. People really like maps. And we want to know sort of how many months of the year are there suitable landscapes for the transmission of these diseases. And it turns out that people also like the idea of knowing where the people are as well. And so sort of overlaying these risk maps onto population density was our first hint that this was a good way to communicate some of these more mechanistic ecological models to the public. And we then cruised from malaria into dengue because there was enough lab evidence to parameterize another thermal model for dengue, but it turns out there were 2 vectors, and then there were 3 diseases circulating by the time we got this model together. There was dengue, chikungunya, and Zika. People hadn't done this full temperature ranges of Zika and chikungunya, but we were trying to assess, sort of this thermal suitability for these 2 vectors of dengue at the time. And so we did some more of these maps, looking at how many months of the year are suitable in the Americas for the 2 different vectors, one of which operates at a bit of a cooler temperature in its optimal transmission. And so we see slightly different risk maps emerging. And then I took this and played with it with climate change models to sort of say, where in the world are these going to go in terms of the suitability for them to show up, invade, and start transmitting? And we wanted to think about sort of the people at risk, but there's lots and lots of climate models out there. And so we wanted to look at these different concepts of mitigation pathways, different time horizons of the future, and think about that in terms of how many people around the world will be affected across these different realizations of atmospheric models from different climate centers. So I sort of learned a bit about climate models as a result of this. And then some of this has been incorporated into decision-making frameworks. So USAID's President's Malaria Initiative contracted me to do some of this. And that was when we started asking questions like, how do people describe seasons? And so this is relevant to thinking about pandemics, because thinking about how people describe what they think is a pandemic is important. And so you may have different interventions, whether things are endemic or seasonal epidemics. And coupling this question of risk to demography lets you calculate things like how much money things are going to cost. That's not in my wheelhouse, but I can help sort of inform those decisions with these mapping approaches. At the same time, these climate realizations start changing. People create bespoke models. We also have different ideas about what demography is going to do in response to change on the landscape in the future. And so we have not just shifting suitability in terms of climate, but also in terms of people. And how do we want to think about that in these framings? So then colleagues went back into the lab and they infected Aedes aegypti with Zika. And so we then had Zika curves to look at. Turns out Zika is not exactly like dengue. It starts a little warmer. And so again, we went and put these on global maps. And we wanted to communicate this a bit better in terms of thinking about mitigating climate change for disease. So what we produced here was thinking in these global burden of disease regions, which regions are going to be more impacted given these different mitigation pathways for future climate projections. And so we're sort of thinking about how to communicate that risk to people in terms they want to use to make decisions to respond. Scaling back down, I've taken a temperate flavivirus, West Nile virus. Recently, we've seen a lot of cases in Florida, and my question was really, in these highly populous counties, is there more suitability for more of the year for them? And the answer is actually yes. And then we can couple that again to sort of climate forecasts in the nearer term and ask these questions: where should we be surveilling on the edges of those ranges? What should we be thinking about, worrying about? And this has worked across multiple systems for different things, this ecological approach. However, there are other ways of thinking about the environment that aren't just temperature. And so ecological niche models are this other approach that we've been thinking through. And in the context of public health, we need to make sure these are environmentally driven diseases before we throw them into this kind of modeling framework. We need to think about sort of what concept of niche we think we're describing. And this example in the bottom here is simply taking ecological niche modeling approaches to looking at larval surveillance data at the household level in Ecuador and saying, in the future, where do we think that Aedes aegypti vector is going to expand in the landscape, and where is it going to disappear in that landscape? And that helps sort of inform some national level vector control questions that were being asked. There are lots of different algorithms for this. I know Dr. Papish has talked about that as well. And so one of our other questions was, given people are getting excited about tick-borne diseases in the United States particularly, when we're making these maps, are we mapping the vector itself? So are you going to run into a tick in the landscape? Are you going to run into an infected tick? Are infected ticks the same distribution as overall ticks? And we were lucky enough to have access to a really good database of records on this across the landscape. But as we see, when you use different algorithms, you get different looking maps. And so that's something we really need to think about when we're trying to communicate this environmental risk. So that was very fast. I will now talk about things that I thought about as we were looking at these plenary talks. And I sort of came up with a couple of themes. And I think that interactions at multiple scales is something that people were talking to and something to sort of hang on to as we try to couple together what everyone works on. And so at this very fine level of the microbiome and metagenomics, Dr. Bromberg is presenting us with this really nice tool to think about what makes something functionally pathogenic. Can we throw lots of data at it and elicit these patterns of thinking about, what is that one that's going to come out as pathogenic? Then we have this level of thinking about contact with the pathogen, and Dr. Lofgren talked about these nosocomial settings. Dr. Stone talked a bit about vectors in the environment and rare pathogen persistence. Dr. Pilosoff talked about the eco-epi spillover interface. So, sort of when do you go from the ecological to the epidemiological? I thought that was very nice. And then Dr. Papish and I are talking about this sort of landscape level risk where you encounter that risk. Then when we're thinking about sort of more direct transmission, we're talking about the level of people and people, right? So Dr. Morris, Dr. Jones talked about how people interact with other people, how you quantify contacts. Dr. Chow talked about sub-epidemics and how those make up the bigger epidemics. And a lot of this conversation went into sort of how do you do compartmental deconstruction and how much of that detail matters overall. There was also this discussion.
Can I ask you to take just a few moments to wrap up?
Okay, sorry. There was also this discussion of detecting pandemic patterns. So Dr. Faravalli talked about change detection. Dr. Lofgren talked about nosocomial amplification when we see that. And extreme event detection was, what Dr. Sapsis gave us a framework for. And then there's this other sort of interaction-y thing that I saw, which was people and their interaction with the prevention or intervention. And that was, sort of Dr. Jones talked about that. Dr. Bashir talked about speeding up response by speeding up workflows. Dr. Bromberg's talking about speeding up pathogen discovery. Dr. Olszewski is talking about how best to intervene. And I was talking about how to show people risk. And so then the big question is, when's the next big one? So what is it going to be? So Dr. Bromberg is characterizing pathogenic types. Dr. Stone, is talking about surveilling these risky vectors if it's going to be a vector-borne one. And other folks talked about sort of identifying this human interaction interface. And I think that's particularly important. I don't think we really discussed yet things like the livestock interface, where we've seen some pandemic emergence, or that sort of growing urban interface. And I know a lot of us actually work on it. And I just wanted to note that I like that our acronym is PPE because it's two scales of thinking about dealing with pandemics. That's it from me for now.
Fantastic, and we're grateful for your remarks. I look forward to having you in the rest of the discussion. I'm going to take this time now. Oh, thank you. I'm going to take this time now to introduce our next speaker. This is Dr. Themis Sapsis, who is the Doherty Associate Professor in Ocean Utilization in the Department of Mechanical Engineering at the Massachusetts Institute of Technology. He received a diploma in Naval Architecture and Marine Engineering from the National Technical University of Athens in Greece, and his PhD in Mechanical Engineering from MIT. His lab focuses on understanding, predicting, or optimizing complex engineering and environmental systems where uncertainty or stochasticity is equally important with the dynamics. So we welcome you, Dr. Sapsis, and we look forward to your remarks.
Thank you, and thank you for the invitation. I'm probably from the plenary speakers, probably the least connected to pandemics, but I do work on the prediction of extreme events, and I was very intrigued by the presentations that I attended. So I want to make a few remarks regarding the analogies and the challenges and what I have been focusing on. So as you probably saw in my talk, I emphasize the difference between rare and extreme events. My background and my interest is on fluid mechanical systems. So in this case, like one analogy that I see, and I was very intrigued, is these high dimensional spaces, large number of variables, large number of agents or high dimensional networks. And in particular, I was very much intrigued by an example that Dr. Morris showed, where a slight change in the social behavior can have a tremendous effect on the connectivity of the network, on how things propagate. And one of my goals in my own research is to try to detect this type of critical thresholds. But again, the challenge is that the dimensionality is very big. The other aspect that I want to emphasize is the multi-scale character. We hear the discussion about agent-based models, network models, different scales, and I think there are a lot of opportunities there to develop smart order reduction techniques so we can explore possible scenarios, how things, again, work with each other. And then the other point I wanted to make is about targeted data that Dr. Lofgren mentioned. And it was also, of course, emphasized in other talks, what I call smart data versus big data. Of course, the framework there is active learning, but I've seen from the world of complex systems with applications in fluids that active learning alone is, or the standard recipes of active learning is not sufficient for this type of problems. Like when you have extreme events or you are interested to do targeted observations with emphasis on extreme events, you need different acquisition functions. You need to give the weight to the nodes, not just to get information, but to the nodes that presumably will lead to an extreme event. Again, I think there are a lot of opportunities there from the mathematical or the applied math perspective. And finally, I want to emphasize one point that Dr. Jones made about theoretical understanding and development. I think one major advantage that we have in the context of fluids is that we have very good understanding of the mechanisms, and that helps us not only interpret the results, but also optimize and formulate the computational methods. So these two things should go hand by hand. These are the points I want to make, and I look forward to the discussion.
And we look forward to having you in the discussion. Thank you so much.
Sure.
Okay, and I just want to, before we invite our next speaker, I want to check to see if they are present. And I don't think so. Okay, so we're going to jump to another speaker. Okay, so next we're going to have Dr. Venu Viravali, who received his PhD degree in 1992 from Illinois, MS degree in 1987 from Carnegie Mellon University, and a B.Tech degree in 1985 from the Indian Institute of Technology in Bombay with silver medal honors, all in the field of electrical engineering. He joined Illinois in 2000 and is currently a professor in the Electrical and Computer Engineering Department. He also holds appointments in the Department of Statistics, the Coordinated Science Laboratory, and the Information Trust Institute. So Dr. Viravali, we welcome you and we look forward to your remarks.
Thank you. Let me see, I should probably share my screen. I have one slide just to organize my thoughts a little bit, but I'll try and keep my presentation short. One advantage of going last is that I think a lot of what I wanted to say was already covered by previous speakers, so I don't have to say all that much. So my talk or my role in this workshop is I was talking about the problem of quickest change detection or sequential change detection, which is a statistical technique that can be used to detect subtle changes in distribution. Okay, so and the idea is that you want to do this in an online as opposed to offline fashion. So you do it as you're collecting data. You want to see if there was an abrupt change in the distribution of the data. It's maybe a small change, and you'd like to do this with as little delay as possible, which is why it's called quickest change detection, while making sure you don't have too many false alarms. Okay, so yeah, I want to emphasize again that this is different from offline detection, change detection, where you might collect a bunch of data and do a postmortem analysis of the data and say, okay, let's see, let me try and figure out where the changes have happened. And this might, for example, in something like when you look at things like climate change data, and you want to go back historically and see where there might have been significant events that caused climate change, that would be an interesting problem. But what I'm talking about is a problem where you're actually monitoring the data online and you want to detect when there's a change in the distribution. So in some recent work that was actually funded by an NSF project, we looked at seeing whether we could predict. This was after COVID already happened, after the first wave happened, and things seemed to settle down. And the question we asked was, could we use this quick exchange detection approach to predicting a new wave of the pandemic? And so we were able actually to develop a data-driven non-parametric test that that seems to be, at least, pretty effective at, based on random testing data in various counties, seems to be quite effective in predicting the emergence of a second wave. And we saw that it was very, very good at predicting that we were going to have a strong second wave sometime in November when people started socializing more. So, but the big question for this workshop is, can techniques like this help the detection of the emergence of the pandemic? So can we even basically avoid all the problems that we have? If you could predict it before the first wave happens, then that would be a lot more useful. And so for this, I have a lot more questions than answers. It's not clear to me what indicators of emergence are. And I think there were several talks that I hinted at, and I think I learned a lot and partial answers to some of these questions by listening to the talks. So changes in certain pathogens, maybe some interactions, ecological interactions, or even human behavior decisions might help in this detection. But how are these indicators sensed or measured? And I think Rashid Bashir talked a little bit about how we might be able to develop sensing mechanisms for these kinds of indicators. But then the question from my viewpoint is, do these indicators change stochastically when a pandemic is imminent? And so if that's the case, and then maybe we can use some of the techniques that we developed to detect those changes, and then we predict a pandemic before it really takes hold. So yeah, so I'm hoping that as we have our discussions later today and tomorrow, that many of these questions will be answered, at least, and so that we can start working together on developing some useful algorithms for this problem. Okay, thank you.
And thank you as well. We appreciate your remarks, and again, look forward, as you said, to engaging in the conversation. And I think, like you, we all have many more questions than we have answers right now. And it's great to have a forum to be able to come together and to discuss those questions as well. So thank you once again. So at this time, I would like to reintroduce Dr. Nina Pfefferman, who you were introduced to as a co-chair of the workshop. Now I'd like to introduce her also as a contributor in this field of science, who will provide some remarks as well concerning her work in preparation for our panel and breakout discussions. Thank you.
Thank you so much. So I will quickly share a few quick slides. So hopefully you guys can see what I've put up there and can hear me. So I wanted to talk very much, so I'm still rooted very much in my own research, and so this is biased by the things that I've worked on. But in listening to the conversations today and in reviewing the wonderful talks that have been contributed, so thank you so much for all of our plenary speakers, there are still a couple of gaps that I want to not say. So recontextualization also, we've been getting some emails saying, I don't really understand where this conversation is going. The goal of this is not really information delivery, it's information solicitation. So I think all of us have been asked, and the plenary speakers have been asked to sort of highlight places where we want conversation. So instead of the normal talk where we're delivering to everyone, like, here are the important things you should be thinking about, I think what we're all doing is saying, here are the important things we're thinking about, but what we want is the answer back of what else should we be thinking about? What are you thinking about? Not so much because we're all in parallel going, okay, now the group will just automatically have the answers, but because then we'll be able to synergistically think, oh, where are there gaps? How can we pull these answers together? And so here are the things I think about that I think we haven't touched on yet, that I'd love everyone to help me think how to round into the things we have all talked about. And then in the breakout sessions and the feedback after the workshop for these ongoing conversations, to sort of seed these perspectives a little bit. So please don't misunderstand me. This isn't a like, oh, we've missed this. This is, here's some other stuff I think about that I think we haven't put together yet. And that's where I see opportunity, but I don't see how to do it well yet. So help. So one thing that I think about a little bit for this, especially as I've been listening to the other speakers, is that prediction as definition of what is a pandemic. When we worry about a pandemic, what is it? It's not just an infection, forget novel. It's not just an infection everywhere at once in the planet, it's a dangerous one. And what constitutes the emergence of a pandemic is also how we contextualize what danger means. Is it mutability of an omnipresent infection? Is it a novel emergence because something just spatially exploded from somewhere it had been contained? Is it some of the climatic? And so some of the researchers we've heard from already have touched on many of these points, but as already in the context of the emergence is the problem instead of the definition is the problem. So I'd encourage us maybe also to talk about how do we find those definitions of which things to monitor to know what we're worried about coming. And then of course, ongoing dynamics themselves are exploitable. And this is absolutely Nina's pet life of looking at static versus dynamic approximations. And I very much love thinking about identifying next proximate cues for real-time decision making. Which things should we be looking at to enable real-time feedback? And I usually don't look at optimal control. I look at feedback control, which is usually provably suboptimal. So how do we start thinking about flexibility under changing circumstances, regardless of the source of those changes? And how do we get that feedback in the sorts of decisions and monitoring that we would want in order to understand? And then of course, incorporating human behavior. So right, a huge amount of my work as a theorist, by the way, we've got some good theorists. Don't count us all out. A bunch of us on the call are theorists. The human behavior isn't actually just about infection, responses to infection, and public health policy about infection. So some of it's still about how we understand pandemics is very much surveillance based, but not about infection. It's who's looking for which signals and when do they change. And sometimes we actually avoid looking for problems we can't fix. So if there are economic disincentives to noticing a problem, we've noticed that on global scales of emergence and interruption. That's a huge behavioral issue in how we look for things. And then of course, there's also the more extreme, a lot of behavior is actually about ongoing social requirements from family and economics and social and societal function that isn't anything about infection, but desperately modifies how our understanding of pandemic emergence is shaped and which things are dangerous and which interventions will or won't work. So I want to bring that into and round out some of the things that have already been said with those things. And of course, many of the plenary talks focused on really beautiful things. I tried to categorize them in a way that I thought would be an interesting way to try and leverage tiers of response. So I thought really that the comments today broke down into, and the talks before broke down into sort of focusing on particular research problems, and then focusing on methodologies pan problem, and then also factors needed for real world viability of solutions. And so I thought that those were sort of common themes that emerged among how we were talking about these things that might be a useful organizational perspective. And that's all I had to say. So hopefully this conversation will continue being a rich invitation for people to tell me I'm missing things or misunderstood things, but thank you all so much. I'm gonna stop sharing now.
Thank you once again. So we look forward to your continued conversation on this matter as well. I'm going to take a second now just to invite Dr. Paschalaitis back to provide some remarks as well. Mini talk on your subject matter of expertise.
Thank you. And let me share a few slides. So hopefully you can see my slides, and what I would like to talk a little bit is about pandemic predictive analytics and make some connections with some of the plenary talks that I've watched, which I think were all very informative and excellent in my opinion. So this is motivated by work that we have done this past year. We worked on the problem of developing predictive models for predicting COVID-19 outcomes So specifically, we were interested in predicting hospitalization, predicting the need for critical care within a hospital, predicting mechanical ventilation, and eventually survival or mortality. And we worked with a number of different cohorts. So the two smaller ones is one from Boston hospitals and another one from Wuhan from the very beginning of the epidemic. And these were actually were cohorts where we had a lot of information about each of the patients within the hospital setting, the entire clinical picture, including labs, including radiological findings. And then we worked with two larger cohorts, one from Brazil and one from Mexico, where there we only had very basic demographic information about the patients, and we had some information on pre-existing conditions. So we developed models that were actually able to predict with fairly high accuracy. It was a bit surprising how high this accuracy was. So you can see areas under the curve that are on the order of 83 to 88% for predicting hospitalizations and predicting ICU treatment and ventilation. So these are results based on the Boston cohort. And what is interesting is that I think through this process, we're able to come up with interpretable models and characterize the signature of the disease, which is quite different than other types of pneumonias. So for instance, we compared our findings with more traditional severity scores for pneumonia, and those types of accuracies are much lower than what we were able to obtain. And we made some of these calculators, risk calculators, available to the broader community. So this gives you some sense of how the disease is very different than other types of pneumonias, and some of the lab results and the biomarkers that are in some sense providing or characterizing a signature of COVID-19. So the question that I would like to ask, which has been motivated by some of the contributions in the plenary talks, is whether we can now think about developing broader risk models for emergence of a pandemic. So can we combine, for instance, the omics information through the Bromberg lab type of work? Can we combine information about how different types of viruses behave in animals, maybe even physiological variables of the signature of these variables of these viruses in animals? Can we combine information about the state of the network epidemic models through the work of Alex Obzewski and others that are doing related work, and then using this data in order to develop predictive models of a pandemic? I think there are a number of obviously limitations and potential challenges. We are talking about predictive models that use a very large number of features. So there are issues of overfitting, there are issues of even having more features than samples. There are techniques out there, and we have done some recent work on distributionally robust predictive models. The issue of outliers in the data is an important one, particularly in this context. So some of these techniques could potentially be leveraged towards developing these types of predictive models. And then I think it is of interest to move beyond predictions, but to move towards prescriptions and to move towards control actions. The control systems community that is represented by a number of us here have done work in that space. So I'm thinking about specific actions that may either dampen a pandemic, for instance, that may take place in the zoonotic space, so that it does not become widespread within the human population, or if a pandemic starts spreading within the human population, then what type of control actions may need to at least shorten the duration of that pandemic. And I can think of two different settings. In one setting, we don't have much available history about the system that we would like to control and make decisions for. And one potential approach is to try and predict based essentially on similar instances. So for instance, there is information about earlier viruses and how they spread and whether they led to severe pandemics. So there are other coronaviruses or other type of viruses that led to more limited outbreaks. And then there are also another setting where we may have information, quite a lot of information about the system that we are trying to control, or even we have an ability to simulate the system. So I'm thinking of this SEIR and other variant type of models. And in that case, things like reinforcement learning could be exploited in order to develop dynamic control policies that are trying to mitigate the outcomes. So I'll stop here. Thank you.
Thank you as well. I'm going to quickly just introduce our next speaker, who you've already been introduced to, Dr. James Moody, one of the co-organizers. So Dr. Moody, we invite you to provide your mini talk as well.
Great, let me get the share working here. Lost it, sorry. Yeah, there we go. So I really enjoyed this, and I can't tell you how much it's been a lot of fun just listening and thinking to this. And I think building on sort of the ideas, the approach that Nina said, that I really want to think about, what are the questions left that I really hope that I can learn more about and think about. I would put them into these three buckets. And the vast majority of our interest as basic scientists is really in data and models, but I think that we can't ignore the third one, which is dissemination. So just quickly to sort of seed some ideas, and again, in the spirit of asking questions. There's been a little bit of questions in the chat and other sort of talks that come up that either rely on data that are there, or that assume data that's not there. And I think the issue that I think that I would love to hear more about, and people's thoughts on, particularly from different disciplines, is how we deal with the inherent messiness of these data. Social data, in particular the human side that connects with a lot of these pieces, is just crap. I mean, the data is just so bad. And so the ability for us to get good data in a way, or to more realistically make good use of the really noisy data that we have. My hunch here, and this is that bipartite spatially linked data has to be the core of whatever sort of surveillance system or modeling effort we build on. So finding ways to deal with that data is going to be really, really crucial. I think that part of this, my interest in this on the data side, is seeing how, frankly, how effective and amazing it's been to watch the community generate data in response to COVID in a shared open access sort of way. So SafeGraph opening up its data for anyone to use was a really big deal. Like, they didn't have to do that, and I think it created a lot of help for a lot of people to do things that they couldn't have done otherwise. So I think ways that we can build partnerships and incentives that make that more likely would be useful, and then ways to help people figure out how to do that well and recognize where the holes are and how to fix them would be nice. On the modeling side, I think that we're all modelers in many different ways, right? And models mean different things to different people. But I think that I really like thinking about some of the questions that have come up especially when Martina's talking about the different levels of data from micro to macro. I might flip it around a little bit and ask, like, what are the level of detail at each of these levels that are necessary? Maybe that's an aggregation issue. Maybe it's a dynamics issue. Maybe it's a quality of edges kind of issue. I'm not entirely sure what I mean, other than to think that, having worked now with a handful of mathematicians and dealing with approximation models, I'm amazingly surprised at how completely simple models work very well in many cases. And I think when we're dealing with these different kinds of diseases, like respiratory diseases particularly that seem to spread quite quickly, these simple models are surprisingly effective. But even in harder to transmit bits, sort of tree-like substrates, backbones on top of complicated models can work well. And so maybe there's an efficient way to get those models in ways that we don't. That leads me to my next question, which is, do we model substrates or flow? Which is, are we out looking for the next bug that pops up, or are we looking to be able to map the landscape so that when we see a bug hit up, we know how to hit it? My hunch is that we should focus on the substrates. There's been probably 40 years of good work done now, just as by way of analogy, on microgrid simulations for forest fires. We don't know where the lightning is going to strike, but we're really good now at knowing when lightning does strike, where that fire is going to spread and how quickly it's going to spread, given the things that are happening in that micro level. Incident command teams now are routinely given the model predictions from what 40 years ago were almost impossible agent-based models to generate with how best to build line and fight fires. So my instinct is that at least we need to, we should probably do both. If we can predict where lightning strikes better, great. But I think that my hunch is that we're going to do best by being able to build something like a forest fire emergent model for pandemics. And the flip side of that then is what does that model contain? I think it's going to be fundamentally heterogeneity. Some of the insights how to scale up and spill over. That is how something that happens in one spot goes somewhere else. And I think we have a lot of tools in that have been used at the surveillance side or the sort of tell me something about the world side that we can turn around and say, turn into the prediction side. And I would like to play with that. The final bit that I think that Jamie Jones spends a little bit of time talking about, just or at least hinting at, which is this feedback cycle with what the public does with what we do. Early on, almost a year ago now, when we were seeing some of the early models of epidemic spread come out, and all of us know what an SIR model is and what it looks like and what the baseline assumptions are. The base population doesn't. My brother-in-law doesn't. He teaches statistics to high school kids, and I showed him this model, and he was completely just had no clue. And he should have been an informed listener to some degree. And so I would like to think that there's some education tool that we can do to help make these models understandable in many of the ways that weather predictions are understandable now. We all bitch that the weatherman gets it wrong, but we don't think they're trying to trick us. We don't distrust them badly. We have at least a base understanding of what's there. Maybe we need goofy guys in bad suits standing in front of green screens, but we need some way to think we can build effective, trusted public knowledge of these things. And I love the talk that was given on maps. I think there are other ways to do maps and other sort of spillovers from this that come from things like dashboards and interactive visualizations and personalized pieces that apps that people can put on that make this fun for people to play with and informative in their daily life. I think that if we can find ways to make this a resource that's beneficial, that would be good. And again, I think it has this tie to scale up processes and network spillover processes. And the great example that again that Martina showed us from the HIV world that really seemed to work was that you take an insight from something like concurrency and you turn that into a message about zero grazing, and it helps. It doesn't solve the problem, it doesn't fix it completely, but it helps. And I think that if we can find those kinds of examples, that would be really useful. So those are the things that I'm hoping to get out of it. I'm learning a lot already and having a lot of fun with this. And again, I appreciate everyone's thinking, and I'll stop there.
Fantastic, and we appreciate yours as well. Thank you so much. Our last lightning talk is going to be from one of our co-organizers again, Dr. Lydia Bororiba. So we welcome you for your mini talk at this time. Thank you so much.
Okay, great. Let me just share my screen. All right. Do you see the screen in full? Do you see it in presentation mode?
Yes, we see your presentation.
Okay, one slide only, right?
Yes, just one slide.
Okay, great. Okay, fantastic. All right, so I have really quick remarks, and there's a lot that has already been been said, so that will be probably a little bit repeated, but I want to sort of frame it in also as a way of introduction in the context of some of the work that I have done and seeing how, in fact, the connections across all these fields and all the challenges, mathematical, statistical, modeling, mechanistic versus other that has been mentioned, all come in. But I want to sort of start with this. We have discussed this. Obviously, we're all here for pandemics and all of us, are aware of this. But given that this is in the public domain, I like to remind the community and the world that just this century, we already had all this long list of scares of pandemics or real ones. And what led me to, in fact, move from one area of research that was really fundamental fluid mechanics to the problems of epidemiology and modeling, where the SARS epidemic of 2003 in Canada, where I was before moving to this area of trying to understand transmission dynamics from a mechanistic and multi-scale point of view. And the reason why I wanted to put this long list here, SARS, of course, the coronavirus, MERS, they're still circulating, COVID-19, which obviously we're with now, but then other respiratory diseases, Ebola, not one of them, but could transmit through many different routes. The reason why I want to put that in, because I think one of the big challenges that we have is that after each one of these epidemics, scares or pandemics, there is this very fast decay time of attention, support, for whether it is from a funding perspective or sort of interest perspective in really preparing for this. And that's why I think that this bringing everybody to this workshop and having the support of NSF to do this and really launch an infrastructure that would have the ability to really go beyond sort of that decay, very rapid decay rate in interest is so critical to prepare the nation and the world for this, because it's bound to continue to happen. And we have seen the effects of not having such preparation at the beginning of this pandemic and still now, for example, in the US. And so I think it's really critical to do this. And I'm grateful for everybody to really be participating in this today to connect. So some of the challenges that have been already discussed that I wanted to point on and adding maybe a little bit of a twist here coming from a more sort of classical and older field of fluid dynamics is that, of course, the data, and that a lot of us already discussed that, data collection is a problem. There was already a discussion about the dilemma between data quantity and data quality that was already mentioned. This is critical for this, but of course for epidemic data, we will never have the sort of clean and beautiful data that we can have in a controlled lab experiments coming, for example, from other classical physics fields. And that's a massive challenge. And we need to be very creative in thinking about how to put in place infrastructures to really centralize, in my view, or at least have a way to have access and very easy sharing of data very early on. And that brings in a lot of interesting human factors in terms of ownership versus centralization, in terms of the limitations of disclosing certain data versus others. And so there is a lot, in fact, it's not really just a data science and mathematics challenge, it's sort of a political and human challenge that really requires infrastructure to put in place to facilitate. And then once this data is there, maintaining databases, maintaining them to be accurate across time in the right formats, easily retrievable, and it requires resources and also an infrastructure that is actually quite substantial. And so that these are I think very important challenges that require efforts beyond the scientific community to really build a structure that is stable for really serious long-term build-up of preparedness against any emerging pathogens. And I mentioned centralization versus ownership, then that becomes a challenge depending on how countries are organized, of course. And of course, with having data, then we can start talking about models that could be predictive. Without data, we're talking about models that are more essentially enabling us to distinguish between hypotheses, but not really being really predictive, because prediction comes after validation. And that brings really to the challenge of validation for epidemiological models. As we know, and already mentioned the issue with the complexity, how many details go in a model, how do we incorporate these details, and how much really accuracy and error do we have in underreporting, in heterogeneity, in what is being collected and where, especially when we're dealing with pandemics, with massive disparities in economic and socioeconomic factors. So there's a lot of challenges there in understanding which scale, which detail we include, but with respect to the quality of that data and the amount of the data that we have, and what is really a validation for an epidemic model. I think that this is sort of a central question, because we know that for these type of high order models, we can essentially fit the same data with many different type of models. And this is a very big challenge, because when we do that, we lose in effect the understanding and the insight on the mechanisms, or at least being able to distinguish between the dominant mechanisms. And that's why it's really important to tackle these, in my view, from very different angles and different models, and never really trust one particular model more than another, because we know that this is not an area in which we can do an experiment that is controlled, release in effect a pathogen and see what happens, to validate an underlying mechanism with a simple, tractable and analytical model. So these are a lot of challenges. So how do we get to that? There's a lot that has been already discussed on effectively multi-scaling and incorporating mechanisms in that. And so I want to just show you at least how I think about this, but how I think also there's a lot of gaps here that require other fields to come in to integrate across scales. And I'll just focus on one aspect, the multi-scale aspect that would link, in fact, the in-host dynamics, the microbial dynamics, the fact that we are tracking mutations, whether we're talking about these mutations being in animal populations before a spillover, or in a benign form, for example, a seasonal influenza strain that might eventually mutate, or benign influenza that is in the bird populations that eventually might also migrate. All of these need to be understood, but how do we link that then to the population scale, the environmental scale, the world scale of a pandemic? And in my view, there's this, at least from the point of view that I have looked at these problems, the space and time dynamics is critical, and we have heard already a lot about that. And I think that will be really important to discuss and hone in through the contributions of everybody about how to do this, and the technical challenges, the data challenges, and in fact the even points of views of what to incorporate at that missing scale. But one key point that often is not so tackled is really what is even transmission, and how is the environment, particularly when we're talking about respiratory diseases, how are the environmental factors contributing? And so the way that I've been thinking about this phase of transmission is breaking it down really into multiple phases that are then linked to physical mechanisms and fluid mechanics mechanisms that are then enabling us to go back to that window where we can, in fact, think about modeling that is reduced, breaking down complex mechanisms in a reductionist way to enable to have controlled experiments and in fact validation, and through that reductionist approach then rebuild the complexity. And I think that's I think a lot of the tension in the epidemiology modeling always between complexity and simplicity, and reductionism and rebuilding complexity. And this is one way that I have been thinking about it, but I think that would be, there are a lot of gaps here that require a lot of different fields, including the human aspects, the human behavior, the details of the immunology and the biochemistry, the whole defense, sort of the in-host dynamics. But then of course, all the other aspects about, again, even if we have a very detailed understanding of all of this, will we even have the data when it's time to really use these models that would be rebuilt from these building blocks to in fact use them as predictions? Or will there be ways to test in advance certain interventions or preventions? So there are a lot of questions there that require answering, and but I want to put in there in the discussion the idea to really bring back in also the biology and the physics and the environmental aspects into the discussions of the modeling, because when we think about modeling, the tools often, as was mentioned, that we have learned are the ones that we're keen to using, but sometimes to solve these complex problems, we really need to use tools that we're not necessarily, that don't necessarily exist, or that we're not necessarily working on. And so really being open to breaking those barriers to using tools that are new or building new tools to really marry different fields is, I think, critical in my view, given the complexity of the process just of transmission, let alone then the additional aspects of where to intervene in these chains of transmission, particularly for respiratory diseases, to really tackle them. So it's a little bit, on my perspective and how I see a lot of gaps, and hopefully how all of those open questions will be addressed through these 2 days workshops. But I wanted to put that out there so that we also keep in mind the marriage of the physical sciences as well, the controlled experiments, the validations of submodels, in addition to the data-driven multi-scale mathematical tools all together to really be prepared to tackle these challenges. And I'll stop here.
Fantastic. Thank you so much. I want to take a moment just to invite our last speaker, who I believe is with us now, Dr. Utkan Demirci. Dr. Demirci is currently a professor with tenure at Stanford University School of Medicine and a principal investigator of the Demirci Bioacoustic MEMS in Medicine Lab at the Canary Center at Stanford for cancer early detection. So if you are with us now, I wanted to invite you to provide your remarks as well.
Sure, thank you. Thank you. Sorry about the bounce back. Let me share my screen so I can present also a few things that I wanted to share today. Can you see my screen?
Yes, we see your screen.
Okay, thank you. So I wanted to talk about a little bit on the importance of point of care tools in detecting and tracking some of these viruses, and how it became so important from the early days on to understand how and quickly monitor and figure out who is asymptomatic and who is not, and who is actually carrying the virus, and who will respond how to the disease. So I believe that kind of brought up an importance of these portable technologies and tools. I'm not only talking about some of the quick antibody tests that were FDA approved, but also some of the tests that are able to actually quantify virus. And when we say quantify virus, the first thing that comes to mind is PCR, RT-PCR type technologies that are now really miniaturized even to smaller devices and gadgets. We don't have them currently to be available at the home setting, that you could go to a CVS, grab one and quickly test yourself. But some of the current technologies that, for instance, we are using here on campuses, people are taking a nose swab or a saliva sample, dropping it off, then it's going out for a PCR type assay, and you're able to get results depending on how busy it is within 24 to 48 hours. I think what we need to see for these types of technology, especially for the viral ones, where you cannot really rely on the antibody or antigen-based tests that are actually have problems in the sense that the first 4 to 6 days, the tests will not be positive. And if someone is already infected, the test will stay positive for many, many months, which takes away the value of the test for new infections even after the first test happened. So I think I feel there's going to be importance of these emerging new point of care technologies, that you could actually do a test at home, like a pregnancy test, but doesn't use their principles, but uses the ability to detect viruses or the genomic material of viruses. So I see a lot of opportunities for some of the complex looking technologies. Like one of the technologies, I put this slide up just to tell you about how some of these technologies can be portable and maybe easy to use. Of course, they need still a lot of development in terms of being able to handle a sample in an automated manner and to reduce the cost beyond a handheld device that can be only made for $20 or $40. At least the testing cost can be brought down. I guess the the value I see in the near future for some of these technologies is rapid tests for point of care for self-use. And at some point, there were interest in NIH and other institutions to develop such tests for home use, for sexually transmitted diseases, for instance, so that people could actually test themselves at the comfort of their homes near the bedside. I think there's going to be, for HIV, there was specific interest to push that forward. I think we will see more and more of such technologies coming out, and even now having a really reliable and valid market to reach out to the customer for them to develop further. So I see a lot of need for simple virus or virus genomic material detecting technologies that hit the range that is within the clinical relevant range of positivity. This has become quite a bit of a challenge for HIV, under suppression, for instance. We are trying to detect things about 100 copies per ml, which is really low, requires really high sensitivity. But something like COVID, where especially what matters is the most transmitting people with a lot of virus load in their, exhaled breath or in their bodily fluids or their nasal swabs and so forth, or in their saliva, that becomes actually reduces the need for how low the limit of detection should be. So that's an advantage, to be able to make tests a little bit more cheaper and yet faster to address this. So I guess to sum up, these emerging, as the previous speaker said, these emerging new types of, coming diseases, we might, looking at some reports coming out, we might see these more often than before, like the hurricanes seem to be hitting more often than before. It will be likely that we will end up seeing such diseases come out, and every time we cannot really do lockdowns, but we will have to learn how to live with them and how to quickly test them before vaccines become available. And I believe it will come through these simple portable tools that are at no cost but sensitive enough to detect things. And I'll stop there. Thank you for the opportunity to speak today.
Thank you for taking the opportunity. We appreciate your remarks.